decision by a federal appeals court has paved the way to possible deportation for thousands of immigrants around the country with humanitarian status. This could affect many of Boston's immigrants from Haiti and Central America. In the meantime, there's broader concern about the effect of immigration enforcement on response to the U.S. Census and access to pandemic relief. To explain is our guest, the CEO from the Massachusetts Immigrant and Refugee Advocacy, or MIRA coalition, Eva Millona. Thank you very much for being with us, Eva.
Thank you so much for having me.
Eva, we're concerned about this recent appeals court decision regarding the further extensions of temporary protected status for immigrants who came here on humanitarian grounds. In terms of people around Boston, who are they in terms of where they come from and what they've been doing with their lives here around Boston?
Yeah, so thank you, Chris. So yes, on September 14th, a three-judge panel on the U.S. 9th U.S. Circuit Court of Appeals vacated a lower court preliminary injunction to blocking the termination of the temporary protected status, which is a humanitarian status that doesn't lead to permanent residency. That affects over 400,000 across the nation and over 12,000 here in our Commonwealth, people who have temporary protected status from El Salvador, Nicaragua, Haiti, and Sudan. One thing I wanted to emphasize is that as disappointing as the court decision is, it doesn't have immediate impact. So for people who are TPS holders, from Nicaragua, Haiti, and Sudan, if everything goes, first of all, let me say that the case will be litigated, so this is not a permanent decision. It will probably go up to the Supreme Court to decide. So that affects 400,000 people across the nation and 12,300 TPS holders here in Massachusetts. For TPS holders from Nicaragua, Haiti, and Sudan, if the Supreme Court decides to end TPS, that means that TPS holders from Nicaragua, Sudan, and Haiti are subject to deportation by March 5th, 2021. And for individuals who have TPS from El Salvador, they have till November 4th, 2021 due to an agreement between El Salvador and US. So the court decision doesn't have an immediate impact now, but it's troublesome, of course, and we're very, very concerned about this court decision and how that will impact, over 12,000 people here in our Commonwealth who are part of our workforce, who have families and are part of the community. Many individuals from the Haitian community who are TPS holders are working in nursing home and in the healthcare industry, and particularly at this time of COVID crisis, their services are so much needed and their countries are not ready to receive them. For El Salvadorian, as I said, they've been here for over 20 years, and there is no direct impact, but as the case will be litigated, plaintiffs have said that they will litigate and will appeal the case, and you might go up to the Supreme Court, and it depends very much what the court decision will be to determine, what's happening. There is a bill in Congress pending. The House passed the Promise Act that has that deals with the Dreamers, but also with TPS holders that would provide a longer term residency for these individuals who have been here for a very long time and are very much part of our communities and our fabric, and their countries are not ready to receive them because of the conditions.
Depending on their status, most immigrants have at best limited access to government benefits in this country. The Trump administration at the beginning of the year, I think, changed that somewhat by, I guess, disincentivizing use of legal benefits for a lot of immigrants. How has that played out during the pandemic?
So the public charge, I just wanted to say that it's not a new issue. Public charge has been in the books for over 100 years, but under the Trump administration, everything has changed, and via executive orders um, and changes, it's a completely new vision for inclusion of immigrants and refugees. So the public charge is a test that applies to those individuals who are subject to pursue a green card. And it looks at the totality of circumstances, at their age and profession and level of education and health and all of that. The new rule that went into effect on February 24th, 2020, allows the federal immigration officers to really look into the public charge and determine if the person is likely to be on benefits or to be a burden on the government in order to get a green card or not. And there are certain examples what the public charge applies to, and cash assistance and other public benefits. So it doesn't, and it applies only to those who apply for a green card. But many immigrants who are not subject to a public charge test are still very concerned about how that would affect them or their family members. There is also a lot of miscommunication, a misconception on this issue. But we have seen that during COVID, and this was a result of also a survey that MIRA did in July, statewide, reaching out to immigrant and refugee communities. We had about 433 responses back, and for individuals who lost their employment, who needed to access cash assistance and food, and also testing and healthcare services. And it was confirmed through the survey that public charge, it's a concern among our communities. People are really afraid that if they access healthcare, if they access services, that might impact their ability to receive a green card. So the concern is real. And there is, the issue still remains very present among immigrant families, and especially those who have applications pending for.
You're also trying to send out the message that if people have some needs, whether it's for healthcare, food assistance, they might be out of work, what should they know about where they can go to safely get help?
First of all, I will invite people to go to the MIRA's website, www.miracoalition.org. We have fact sheets on public charge that very clearly state examples of who is subject to public charge and who should not worry about the public charge. That doesn't apply to naturalized citizens or green card holders or refugees or asylees or survivors of domestic violence and certain people who are paroled in. And there is also, there are the rules that who should be worried about and concerned about that, and what are some of the benefits that people can, some of the safety net benefits that people can access in times of crisis. And also, there is a network of organizations working with MIRA that will be able and available to answer any questions. We're doing a lot of education, but I would start with our website. I would start with the materials that we have that are very clear in terms of who is a subject of public charge and how does this test apply to individuals who need to receive access to services or other safety net benefits.
I want to ask you about this year's U.S. Census. Boston was one of the areas in Massachusetts where census response lagged behind. And years ago, now with the pandemic, the immigration enforcement climate, what do you see happening?
So census is another major concern that we have, and it's very little time left to work to make sure that there is a full count for our Commonwealth. There is a statewide complete count committee that I have the privilege of chairing and working with many members of the committee across the state. The Secretary of State has done an amazing job in getting the committee together and providing the resources. So has the Massachusetts legislature to really reach out to make sure that Massachusetts has a full count. And it has been really very challenging particularly to get into areas that people are hard to reach, and Boston being, one of them, but also Lawrence and Chelsea and Worcester, going further into the western part of the state, has been a challenge. And even in in regular times, in previous censuses, it has been really challenging to get accurate numbers and to get everybody counted. Under the current census, COVID added another layer, the federal policies, the citizenship question back then, and then the memorandum to exclude the undocumented. That was another victory last week, thanks to the courts, have really added another layers of complexities on the census. So it is real. Billions of dollars are at stake. Census is about integrity. It's about power, political power, and resources. So we remain concerned, and we're doing everything that we can to make sure that everyone counts. And especially the court decision last week saying that, the president's memorandum was unconstitutional. It's another signal that everybody counts, and that we need to work together to make the impossible in the next 2 weeks left to get everybody counted. We would hope for another extension. We need another month at least. But it remains still challenging, and a lot that needs to be done. And it's being done, digital organizing, it's social media, it's reaching out by, phone banking. In the last few months, we've reached out to over 200,000 people to make sure that they understand and address the concerns and the fears of the community, especially immigrant communities. Looking at the big number of 1.6 million hard to reach, 1.2 million are foreign born.
And finally, Eva, a brief reminder for people if they want more information from MIRA, the website, if people want to go there.
MIRAcoalition.org. There is an entire page on resources when we talk about the public charge, when we talk about the census, and also there is information and all, immigration related issues, including the statement on TPS and the dates as to where the impact, will be March 5th date that I mentioned, 2020, and November 4th, 2021. And hopefully, Congress will act. It's, the court decision on TPS. It should be a wake-up call for Congress to really address the issue of TPS holders who have been here for 20 years. Such as in the case of El Salvadorians.
Thank you very much for taking the time to join us.
Thank you for having me, Chris.
Eva Millona from the MIRA Coalition. We'll have more news in just a moment.